there was a time when Liberal Democrat health ministers put mental health centre stage. Indeed, many of you will remember with pride the amazing work of Norman Lamb, who introduced the first waiting time standards for mental ill health. But under this Conservative government, mental health has dropped off the political radar. Today, the nation's deteriorating mental health is one of the biggest challenges we face. We know that 1 in 4 people in the UK will suffer from mental ill health every year. And I suspect that every single one of us in this hall has either experienced mental ill health or we have a loved one who has. That's why today I'm starting to set out our plan for mental health services. Our plan will tackle the long waiting times and the poor access to services, especially those for children. The shocking reality of the nation's mental health now is that the average age for the onset of a mental health disorder is 14 and a half. So that's why our plan starts by rolling out community mental health hubs for children and young people in every area of the country. Rather than leaving children to suffer in the shadows, every child and young person should be able to access the early prevention and support that they so desperately need. It's why we want to see a qualified mental health practitioner in every school, something that our education spokesperson, Munira Wilson MP, and I have spent years calling for. And this would go hand in hand with our pledges to expand young people's mental health services up to the age of 25 so they don't face a cliff edge of support. And we finally want to put an end to out-of-area placements for mental health treatment, which strip people of the very support networks they need for their recovery. Conference, we know that children and young people are at incredibly high risk of mental ill health. But as we get older, none of us are immune. Indeed, there are numerous points in our lives where we could find ourselves unwell. Men aged 40 to 49 are at the highest risk of suicide. 1 in 5 women develop mental health problems during pregnancy or in the first year after childbirth. And 85% of those above the retirement age who are suffering with depression receive no help at all from the NHS. People between the ages of 40 and 74 do, however, receive NHS physical health checkups. Checkups that test for early signs of kidney disease, diabetes, stroke and heart disease. But no such routine checks exist for mental health. Or not yet. Which is why, Conference, I am delighted to announce that today we will introduce mental health MOTs. These will be mental health checkups at key points in people's lives where we know that their mental health could be at risk, to ensure that everyone across all ages are signposted and can access the support they need for their mental health. Mental health MOTs should be just as routine as physical health checkups, and it will show once again that Liberal Democrats believe that mental health is just as important as physical health.